Hi, I'm Dave Clark and I'm working with the Kingsbridge Dementia Friendly community to find out more about dementia, what businesses can do to be more dementia friendly, how we can all access information and support, and how we can ensure that the younger generation are also included in the picture. In this podcast, I'm talking to Karen, a consultant nurse for older people, about her work, which is focused on making the environment in an acute hospital a better experience for those with dementia, their carers, family and friends.
So my name is Karen, I'm a consultant nurse for older people, and I've worked leading dementia for a number of years. It started about 10 years ago. There were some Southwest standards for people with dementia in general hospitals set about locally across Devon, Cornwall and Somerset, and we were part of those, developing those standards. There was a clinical reference group. Also at the time there were lots of work nationally recognising how difficult it is for people who have dementia, and the need for hospitals in particular to raise awareness of the needs of people, to be able to be supportive to them and their families, to make coming to an acute hospital a better experience.
Hello, can I help?
Level 7.
What are you looking for?
We're looking for, it's not got his people.
Certainly people with dementia will come with a range of issues, health issues. They might come for a planned investigation, a planned outpatients meeting. They might come for planned surgery, or they might come in under urgent services with, they might have had a fall or they might be quite ill. They come with their dementia, usually not because of their dementia. So it's important that we have services that understand people's needs of those who have dementia and their carers across all of our service lines. We have a lot of people with dementia. I know at any one time we can expect between 10 to 20% of our patients in hospital to have dementia.
Right, it's quite a lot, isn't it?
And yes, and again, across, on your heart wards, your surgery wards, your respiratory wards, as well as your healthcare of the elderly. So before we had a better awareness, people with dementia would come, and the first thing is just coming into an acute hospital can often cause them to be more confused than normal. Just trying to find your way around an acute hospital. It's confusing for anybody, let alone if you have a cognitive impairment that makes your problem solving, your short-term memory, all those things worse. We didn't used to have particularly welcoming visiting and carer support, so you would be left at the door and then you'd go for the investigation. Your carer and loved one would be waiting, anxious, you'd be separated from them. Visiting times would be very strict. You could come at 2 till 6 and then maybe till 8, but not very inclusive of carers. So for instance, having a quiet space like we're in the busyness of an acute hospital is imperative. Somewhere that's less frightening, less noisy, with less distractions. The ward environment we've done a lot too. We've done a lot on signage so people can see the way out, people can see where a toilet is, where the bathroom is, and each individual bay now is got a different colour, so you can be told I'm in the red bay. So we've done awareness sessions, so a number of staff have done the Alzheimer's dementia champions training, so they can deliver dementia awareness sessions at local level, and we've done that for loads of our staff in their teams, in their updates, in their continuing education. We've had our chaplain visitors, our volunteers, so that kind of training is made available across the board. And we also have, for the past, I think 4 or 5 years, delivered a degree level module, a post-reg module for qualified staff, nurses, doctors, allied health professionals, which will give them much more advanced knowledge and deeper understanding of dementia. So we have a leaflet called Getting to Know You. So our staff will know if they know they've got somebody who has dementia, we'll flag them with a symbol on our clinical information system so that everybody who's looking after that person knows that person has dementia. They don't know what kind of dementia, they don't know how advanced the dementia, they don't know how it affects them, but they know they have dementia, so they know they need to ask a few more questions.
Right.
They know they may need to involve their family members to get a really comprehensive picture of that person. Some people come with dementia with a "this is me" that they've already, or some kind of life history, and they come with it.
Okay.
And it's lovely because then we can look after that and learn all about them.
So that's something that
That's
people,
what
that carers and patients, families can think
Can
about,
do, yeah.
is giving you some background information.
yeah. And if it's all written down,
Yeah.
that's even better. It's often seemingly a little thing, but it makes a big difference.
Yeah.
So it's learning the little things about that person. So I think enabling carers to stay with people has been really helpful to both the person with dementia and their carer. And in an acute hospital, the biggest thing we need to do is reduce the distress, help them orientate, because it's frightening. It's frightening for anybody. And lots of our clinical environments are very frightening. They're noisy, they're bright lights, it's non-stop, it's 24 hours, all this noise and bright lights. There's a lot of work and a lot of funding going towards research for dementia. At the moment we haven't got a cure. So the research that is currently happening is looking at medications that will slow down the progression of dementia and research into the best kind of models of care. And we know the best models of care are community-based. So in terms of next for Derriford is to see fewer people needing to come into hospital. So we've recently opened an acute assessment unit at our front door where people with frailty, including people with dementia, could come and have the investigations and maybe the first start of their treatment without having to be admitted to a ward. We're also part of the Plymouth Dementia Action Alliance, so any of the advances in care of people with dementia, we're one of the few health organisations. Other organisations are schools, solicitors, retailers, banking. Health is a relatively small minority sector really, because most people with dementia don't come to hospital, whereas most people with dementia do go shopping.
Sure.
And do go out to libraries. So that work is keeping us focused on how we can improve the lives of people with dementia outside of hospital.
You've been listening to Dementia Lives, and my thanks go to Karen for speaking with us about her work within the acute hospital at Derriford. If you'd like to find out more, please search for Kingsbridge Dementia Friendly Community. The environment within an acute hospital can be confusing for anyone. Karen has shown the benefits of some well-planned staff training. This has been a How production. Thanks for listening. Please share and subscribe.